Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the July 9th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County has added 72 COVID-19 cases since yesterday and 234 since my update 1 week ago on Thursday, July 2nd. As of Thursday, July 9th, Dubuque County has 829 positive COVID-19 cases. No additional deaths have been reported, so a total of 22 deaths remains in Dubuque County. About 6% of the just over 14,000 people tested in Dubuque County have been positive. 8 individuals are currently hospitalized, and that's 3 more than I reported last week. About 54% of Dubuque County positive cases have recovered to date. The state added 819 cases since yesterday. As of July 9th, 2020, Iowa has a total of 33,240 positive cases. That's about 3,108 more than I reported on July 2nd. In all, about 1 in 9 Iowans, or over 360,000 people, have been tested, and about 9% of Iowans tested have been positive. Deaths reported in the state total 739 Iowans, the majority of those being greater than 80 years old. Currently, 168 cases are hospitalized, and that's an increase of 23 from last Thursday. Finally, about 79% of Iowans have recovered. I said this very same thing last Thursday, but today's positive case count is the highest we've experienced here in Dubuque County. And I'm sure the totals, when you're watching this, will be higher than those I just reported. On June 26th, 41% of the positive cases were in the 18 to 40-year-old age group. Today, that number is 54% of the cases in the 18 to 40-year-old age group. Now that we're seeing exposures and household contacts of these positive cases, our numbers are increasing more. This continues to be the reason for all of us to maintain physical distancing by staying a minimum of 6 feet from others when you're out in the community, whether it be at a store, a restaurant, or wherever. Better yet, staying home and avoiding unnecessary trips altogether is good practice. And we can't let our guard down on wearing masks and when out in public or at our work sites, along with frequent and proper hand washing. You may unknowingly expose yourself to a positive case who is not exhibiting symptoms or only has mild symptoms that are not obvious. Many of you are wanting to be tested or are not sure if you should be tested or need to be tested. If you've been practicing all the safe public health measures I just mentioned and not putting yourself at risk by being in places or with people that include crowds and lack of physical distancing, and you've not had an exposure to a positive and or symptomatic person, you probably don't need to be tested. However, if you have had a known exposure to a positive or symptomatic case, testing would be warranted, but not absolutely necessary. Keep in mind, regardless of the test outcome, whether it's positive or negative, you must quarantine for 14 days from the date of the last contact with the positive person. Same is true for if you live with someone who's positive or symptomatic and you can't separate yourself in the home. That's an exposure and you could consider testing. But remember, when you do test after being exposed, a negative test in either case does not eliminate the need for the 14-day quarantine for you. You cannot test your way out of quarantine. So, where should you get tested? If you're symptomatic and have a known exposure, it's best to call your doctor or healthcare provider, and they can evaluate whether or not you need testing and may also want to evaluate your symptoms in person or through telehealth in order to provide any treatment or guidance. This is especially important if you have an underlying condition that puts you at greater risk for severe illness from COVID-19, such as lung or respiratory issues, diabetes, obesity, immune suppression, or if you are a smoker. If you are simply a contact or exposed to a positive or symptomatic person, the Test Iowa Clinic may be the way to go for you. All you have to do is the assessment at testiowa.gov and show your code and Iowa ID at the Test Iowa Clinic site at Epic Health and Wellness, 1075 Cedar Cross Road. They'll be open Monday through Thursdays, 5 a.m. to 9 a.m. until further notice. This Saturday, there will be an additional Test Iowa clinic at the Crescent Community Health Center at 1689 Elm Street. That's next to the Eagle Country Market, and that will be from 6 a.m. to 10 a.m. I know these times are early in the morning, but everyone is working and waiting in line outside. And since we're having hot summer days, beating the extreme heat is important for both the clinic staff and those wanting testing. Tomorrow, I'll provide a detailed explanation of isolation and quarantine, including when you need them and for how long. In the meantime, thanks for tuning in today. Let's all be safe and practice public health measures. When in doubt, don't go out. And remember, we all continue to be in this together.